Hello, and thank you for your interest in riding with Sedgwick County EMS. In this short video, we're going to talk about several different aspects of what it means to be an EMT or paramedic with Sedgwick County EMS. So let's get started. Within the Sedgwick County government, EMS is located within the Public Safety Division. We are actually a separate entity from the fire department, which means that we are called a third service model of ambulance delivery. The EMS department is overseen by a service director who works closely with a medical director. Our medical director and the clinical practice manager are a separate department within the Public Safety Division called the Office of the Medical Director. But going back to the EMS division, it subdivides into two sections, operations and administration. Both of those sections are led by a deputy director, and then each of those sections divide further. Sedgwick County EMS employs 122 full-time paramedics and 30 full-time EMTs or AEMT positions, and we have 78 part-time positions for both EMTs and paramedics. Most ambulances are configured with one paramedic and one EMT, and this actually allows us to ensure that all emergency calls will have at least one paramedic on scene, which gives our patients the highest level of clinical care in the pre-hospital setting. Now let's talk about the difference between an EMT and a paramedic. As you can see on the chart, the biggest difference is the amount of education required to complete the course and then test for your certification. The next biggest difference is the scope of practice. EMT classes require at least 200 clock hours of education and skills training. The EMT curriculum is a prerequisite for anyone looking to continue their education with an AEMT program and or the paramedic program. At the paramedic level, education is heavily focused on physiology, pathophysiology, and pharmacology. Sedgwick County EMS also has additional special programs. Sedgwick County has critical level paramedics working throughout the county 24 hours a day, 7 days a week. This certification requires education and training above and beyond the level of a typical paramedic, and this allows them to deliver advanced care to some of our more critical patients using specialized equipment and technology. Sedgwick County EMS also operates as a partner within the Integrated Care Team, or ICT-1. This team responds to community mental health issues or crises whenever they occur. We operate a bike team for special community events where there may be a large gathering of people, and the bikes help allow for easy access in crowded areas. We maintain readiness for radiation survey and detection team in the event that a radiological disaster occurs within our response area. We have a disaster management support unit that assists with mass casualty or large disaster events that may have a long duration time. We also operate a biosafety transport team that was established during the Ebola outbreak for highly communicable diseases. We also have an honor guard team that attends special ceremonies to help pay respect to first responders who may have passed away in the line of duty. Our peer support team helps debrief our responders and provide emotional support after they have, for example, encountered a call that was particularly difficult. We want to make sure our people cope with the difficult situations they may come across. And finally, we have a professional development team that create and then provide enough continuing education hours to fulfill the requirements for recertification every 2 years for all full-time employees. Sedgwick County EMS is responsible for any and all emergency and non-emergency calls that occur within the county. That's approximately 1,008 square miles, and this does include all cities and communities within it. That is a rough population of about 500,000 people. We operate out of 18 posts or stations. We also deploy our units dynamically throughout the hours of the day, which means that as one area of the city gets busier, we can move more units to that area to make sure that we can respond as quickly as possible. In the afternoon, we have peak staffing, which means that we have about 20 ambulances available. Then we reduce the number of ambulances overnight and the early morning when the call volume is much less, so we're able to fluctuate based on the needs of our community. Our crews work a 2-week rotating shift schedule, X's and O's. They work 3 days on 1 week and then 4 days the opposite week. They're assigned to either the first, second, or third shift. First shift begins at 6 a.m. and runs till 6 p.m. Second shift has units logging on at 9 a.m., and then we have some shifts that start at noon. And then finally, third shift starts at 6 p.m. and goes till 6 a.m. All shifts are 12 hours. The table depicted in this slide shows all the planned ambulances, including their shift times, the shift supervisors, advanced practicing paramedics, and the community response vehicles. The density of calls is depicted in this chart. As you can see, the higher density or larger call volumes is in the core of Wichita. In 2020, we were dispatched to 65,708 calls. Of those, the emergency calls were 56,224, and that makes about 86% of our calls. Non-emergency calls, like transfers, are approximately 9,484 calls, or 14% of our call volume. Out of all the 65,000 calls, we had approximately 57,565 patients that were seen. We transported 43,370 of those patients. Priority 1 and Priority 2 count for 28,401. Priority 9s were approximately 435. CRV had about 81 calls. Overall, we run around 178 calls in a 24-hour shift. As you can see here, we have a general increase in call volume from year to year. In 2020, Sedgwick County EMS ran 65,708 calls. That also includes non-emergency interfacility transfers. We're expecting to run 66,000 calls in 2021, and again, that averages to about 180 calls in a 24-hour period. The pie chart in this slide depicts the categories of patients reflecting their acuity. Now, acuity means the degree of sickness of the patient's condition. Green is the lowest acuity, meaning the patient's condition is stable and not life-threatening. The next level is yellow. Those are conditions that require further assessments and diagnostic tests and treatments. The red group is the most critical patient. Those patients are experiencing life threats and require emergent treatments and stabilization. The blue portion, or code blue group, are those individuals that present in full cardiac arrest and that require full resuscitation efforts by our crews. The orange is the psychiatric group, or those experiencing behavioral emergencies. The black wedge that you see are those who are dead upon arrival and resuscitation efforts are not indicated. As you can see, the largest acuity of patients that we treat are code greens and code yellows. So as someone calls 911, dispatch is able to obtain information regarding the chief complaint, the phone number of the individual calling, and the location of the emergency. They will begin an interrogation using their computer software that guides them through a protocol set of questions, and then based on those answers, a priority is set to the call and units are dispatched. In fact, GPS is used to dispatch the closest unit to the location of the emergency. Not all emergency calls require a response using lights and sirens. In fact, we use lights and sirens a little over 50% of the time. The decision to only utilize lights and sirens for high priority calls is because it can actually cause a safety hazard to our first responders and other drivers. While our crews are headed to that call, their mobile computers inside the ambulances are giving them up-to-date information from dispatch related to the call. This helps prepare our responders for what kind of call they are headed to. Once on scene, the crews will determine how many patients are on scene, their acuity level, and begin their assessments. Not all patients get transported by the ambulance. Actually, 25% of our patients choose not to be transported by ambulance. During transport, our providers will then continue to render care and reassess their patient. They will reassess their treatments and interventions. Once at the hospital, our providers transfer care in the emergency department, trauma unit, or any other regions of the hospital that they may transport to. While one crew member is delivering the patient care information to the nurse or physician, the other crew member is getting the truck put back together and restocked for the next call. So as a rider, your role is to simply observe. Our crews are happy to answer any questions that you may have during your ride time. Also, you'll be riding in the back of the ambulance with the EMT or paramedic when they're transporting a patient. Our crews are used to working in tight quarters in the truck, so don't worry about being in the way. The crews will direct you as needed to make sure you're seated and secured safely. We ask that you do not attempt to assist in moving patients or assist in any medical interventions. In the event that a patient is combative, we ask that you maintain a safe distance from the situation. Finally, we ask that you do not assist with disinfecting procedures. During your ride-along, we ask that you dress in a neat and professional manner. So, no ripped or torn clothing. We ask that you wear a collared shirt with dark slacks like navy or black. Khaki can be acceptable. You need to wear a belt and dark closed-toe shoes. Tennis shoes are acceptable, but remember that you will be out in all weather conditions. Furthermore, make sure you bring any jackets, stocking caps, or gloves if needed to stay warm in inclement weather. During your ride, you will be required to maintain professional conduct at all times. Maintain contact with your preceptor and crew. We do not allow use of cell phones or cameras during the ambulance call or when you're at the hospital with a patient. When at post, you're welcome to make calls if needed. We do not allow tobacco use inside the ambulances or inside posts. There are designated smoking areas at each post if you should so choose. These rules also apply to vaping devices. The crew will provide you with body substance isolation equipment. This includes face masks, eye protection, gloves, and gowns. Even though you're in an observation role, there may be situations where you are exposed to hazardous body materials. Even as a rider, you are required to wear a mask at all times. We want to make sure that you're safe during your time with us. During the current emergency situation of COVID-19, you will be fit tested for an N95 mask. If you're vaccinated, you must wear the N95 mask on all suspected COVID-19 cases and all respiratory calls. If you're unvaccinated, you will be required to wear the N95 mask on every emergency call. Make sure you're washing your hands frequently, and when you don't have access to hand washing stations, be sure that you're using the hand sanitizer that's located on the ambulance. Finally, there are no open food or drink containers in the back of an ambulance. You will be riding in the patient compartment of the ambulance. You'll be required to wear your safety belt at all times when the ambulance is moving. The crew will tell you where to sit when there's a patient being transported. When you're responding to a traffic accident, it's a good idea to double check with the crew which ambulance door to exit. It's typically safest to exit the ambulance out the rear doors because the side door is a blind exit, which means you can only see traffic coming from one direction. Safety issues. We've discussed infection control and wearing the appropriate PPE to avoid any contact with bloodborne pathogens. In the event that our crews respond to a traffic accident, you'll be required to wear a safety vest that's supplied on the ambulance. Your crew members will help you find it and put it on appropriately. In the event that EMS is transporting a combative patient, you will need to maintain a safe distance from that situation. We ask that you do not assist with any patient restraint. As a healthcare agency, EMS is bound to the laws of privacy. This also requires them to protect patient privacy. You are not allowed to use social media to share information about patients or their conditions. You have to be aware that some of the call information crews are responding to is publicly accessible. Any information that you share that is beyond publicly accessible can be easily associated and therefore constitutes a breach of patient privacy. So it's important that you do not share or comment on any calls that you're exposed to during your ride-along. You should have your rider release form, the release of liability, and non-disclosure agreement. Sign these and your crew member will fill in the call numbers. After your shift, the crew member will then turn these documents into their shift commander and then to administration. The reason that call numbers are recorded is because in the instance that we find out that a patient that you were exposed to has a communicable disease, we can follow up with you. In EMS, we respond to any and all calls for assistance. That can be a range from very simple calls to a very traumatic call. For example, someone who stubbed their toe to a plane crash with multiple casualties, from the birth of a baby to a death of a loved one. Some calls that we encounter, especially those involving children, those involving neglecting the elderly, or those involving substantial trauma, can be a precursor to traumatic stress. In the event that you're observing and encounter a call that's particularly difficult for you to handle, we ask that you notify your crew, and if necessary, we can extract you from your ride-along. When you arrive for the beginning of your shift, please be on time. We ask that you bring your personal belongings and any other items that you may want to have with you, for example, money or food or study materials. Understand that you will need to be portable for up to 12 hours. Just because you show up at a post doesn't mean you will get back to that post at any certain time. Our call volume has increased over the last several years, and our typical call volume is between 6 to 10 calls a shift. Each call can range from 30 minutes to over an hour. So if you bring money, be sure to tell the crew that you need to stop for food. The same goes for if you need a bathroom break. Again, thank you for your interest in riding with Sedgwick County EMS. We hope that you have a valuable experience and that you gain valuable perspective on the role our providers play in the safety net of the healthcare system.